This week, the UK recorded a dramatic rise in cases. So what's in Bojo-and-co's winter COVID toolbox? And when, if ever, may it need to be opened? One thing's for sure, cases are on the rise. Last month, daily infections were at around 30,000 a day. Now, that's shot up to 50,000. But the majority of those cases are among the younger age groups, most of which are not yet vaccinated against COVID-19 and are extremely unlikely to suffer severe consequences from the virus. The rise in cases has not translated into the huge numbers of hospitalizations and deaths which accompanied large caseloads before the vaccine rollout. It's this wall of protection that the government is relying on to keep the country open through winter. But as vaccine-induced immunity decreases, a massive push to scale up the numbers of booster jabs being administered is underway. Ministers are worried that elderly and vulnerable people who received their jabs early in the rollout could now be more at risk of serious illness as their immunity wanes. So if you're eligible, book a third jab. There's a link to follow in the description below. As of yet, the government has said there is no need to deviate from Plan A, saying that case numbers and hospitalisations are within expected projections for this winter and that the NHS is not yet under unsustainable pressure. But this view is not shared by a number of health professionals and organisations. One of the most prominent, the British Medical Association, recently went so far as to say the government is being willfully negligent by refusing to bring in Plan B measures in England. So what would those measures be? Face masks would become mandatory in some settings again. These would likely be the same as before: public transport, walking around hospitality, libraries, places of worship and more. People who did not abide would be breaking the law and have to pay a fine. The government would advise people to go back to working from home where possible. It says this would be to prevent COVID spreading on public transport, in meetings, during social activities and therefore in homes. One of the measures implemented in Plan B would be brand new for England: vaccine passports or COVID certification. That would mean having to prove that you either have a negative COVID test or are fully vaccinated to enter places where large numbers of people gather. There would also be a ramp up of public health messaging, warning people to stay cautious. Less clear is what happens if the situation gets worse, despite Plan B measures being in place. Number 10 has denied reports that ministers are discussing a Plan C set of restrictions, which were rumoured to be a ban on household mixing, similar to the situation last winter. The reports in the Telegraph, however, were slapped down shortly after they were published, with a government spokesperson saying it's important to stress neither ministers nor officials are working on those proposals. That's not accurate.